The visceral peritoneum attaches to the greater curvature of the stomach and hangs down loosely, almost as far as the pelvis, and then folds back to the transverse colon and the posterior abdominal wall. The name refers to the ability of the omentum to move or float over the surface of the intestines. The organ's purpose was originally thought to be to provide insulation for the peritoneal cavity, but has proven to play a far larger role than that. The greater omentum forms from the dorsal mesentery, while the lesser omentum forms from the ventral mesentery. The greater omentum is present from birth, but continues to develop until age 11. The greater omentum is composed of fibrous fatty tissue containing both translucent and adipose-rich regions. The greater omentum may be fairly large, at up to 36 centimeters long and 46 centimeters wide. Each leaflet is composed of 2 sheets of mesothelial tissue containing collagen and fibroblasts. The mesenchymal cells are covered by microvilli, which increase in number and density in response to inflammation. The greater omentum also contains a number of fenestrations with openings of up to 225 microns to allow rapid transfer of cells and molecules between the omentum and the peritoneal cavity. The greater omentum receives a rich blood supply from the celiac trunk and the superior mesenteric artery. The greater omentum produces angiogenic growth factors that dramatically increase blood flow in response to inflammation. Small white patches of lymphoid tissue called Milky spots are found in the peritoneal, pleural, and pericardial cavities, but are most abundant in the adipose-rich regions of the greater omentum. Milky spots are composed of mesenchymal cells surrounding small blood vessels that branch from the gastroepiploic arteries. Each Milky spot contains around 500,000 immune cells, consisting of roughly equal numbers of macrophages, T cells, and B cells, as well as a smaller number of mast cells. The number of Milky spots increases during the first year of life and then decreases with age, although both the number and size of Milky spots increase in response to infection due to a rapid influx of neutrophils and macrophages. Milky spots contain mesenchymal fenestrations that lack a basement membrane, as well as high endothelial venules, or HEVs, which contain distinctive cuboidal endothelial cells that allow rapid transit of inflammatory cells in response to infection. The B cell population consists mainly of B1 lymphocytes, which respond to bacterial antigens and produce antibodies, but are not part of the adaptive immune response because they lack memory. As in lymph nodes in the spleen, Milky spot B cells undergo isotype switching, affinity maturation, and somatic hypermutation. The greater omentum is a complex and vibrant immunologic organ that acts as the guardian of the abdomen. Fixed only along one side, it can slide across the abdomen and is often found in the area of localized injury. For example, the position of the greater omentum can help to reveal the source of sepsis. The mechanism is unclear, but the smooth, mesothelial tissue covering the greater omentum provides nearly frictionless interaction with the peritoneum and visceral serosa, allowing it to move freely in response to gravity and peristalsis. Tissue damage may alter deposition of fibrin and thrombin in a way that causes the omentum to adhere to infected and injured regions. The greater omentum contains resident stem cells and has remarkable healing ability, plays an essential role in spontaneous sealing of intestinal perforations, and can be used in surgical treatment, such as the Graham patch to treat perforated duodenal ulcers. The greater omentum can deliver immune cells to the affected site much more rapidly than through systemic circulation. The greater omentum also contains autonomic neurofibers that can trigger a neuroendocrine response through the hypothalamic pituitary adrenal axis. Stomach and ovarian cancers may metastasize to the omentum, but primary cancers are extremely uncommon. The greater omentum rapidly delivers immune cells to the site of injury and helps to sequester and clear areas of infection and necrosis. Unsurprisingly, removal of the greater omentum is often detrimental and associated with increased incidence of peritonitis. Described as part cuddle blanket, part mendicant doctor, and part Roomba, the long underappreciated greater omentum is finally gaining attention as an important immunologic organ. Thank you very much.